Well, hello viewers. Today I'm sitting down with professionals to talk about the community concern around corona and the vaccine. Corona rages on and still continues to infect and kill innocent people. Luckily, the development of effective vaccines has helped importantly to reduce the catastrophic impact of the coronavirus throughout the world. In the Netherlands, a large number of people have been vaccinated against the virus. Although the vaccine is freely available for all, it does appear that in some neighborhoods, the rate of vaccine uptake is relatively low. This discrepancy is of a major concern to the health authorities, as it puts people in these neighborhoods at a higher rate of coronavirus infection, with a major impact on their well-being as well as impact on health services. Hospitals across the country are struggling to contain the number of people that have been admitted to the hospitals and putting tremendous amounts of pressure on the healthcare professionals. It is therefore important that people in all communities vaccinate to protect themselves and their families and to help ease the pressure on our hospitals and health workers treating corona patients. Today we are going to discuss some of the issues revolving around coronavirus. My name is Veronica from the Kamp, your host, and I'll allow my panelists to introduce themselves to you. Stay tuned. Hello, and you're welcome to this broadcast.
Thank you.
Before we start, if you will let the viewers know who you are and what you do.
My name is Vanessa Harris. I'm an infectious disease doctor, also in internal medicine, and I work at the Amsterdam University Medical Center, formerly known as the Amsterdam Medical Center, the AMC. And I also do research on vaccines, and I treat a lot of COVID patients in the hospital.
Welcome.
Thank you.
Thank you. Well,
yeah, thank you very much. I'm sure that many people know me, so
yes.
Don't have to. My name is Charles Ajman. I'm a professor in the Amsterdam UMC, and I do a lot of work on migration and health, mainly on public health. So it's a pleasure to join this panel today. Thank you.
And
yes, first of all, thank you for having me. I'm happy to be here and say some more about what we're dealing with now with the COVID situation. My name is Alina, and I am a general practitioner, huisarts, here in Amsterdam South East.
you're all welcome, and thank you also for taking the time to sit down with us today. Because, some people think that coronavirus is gone. And we can go ahead and do things we used to do. Is this really true? I mean, what's the current situation with corona in a way? Because we think we are now okay until, all we are hearing is. Can you just give me a bit update?
Yes, of course. I see, unfortunately, a rising number again of COVID patients. And I must say it's shocking to me because, of course, we hoped that everybody would get the vaccine, everybody would be protected. But unfortunately, in some neighborhoods, as you said, we see that the number of people getting the COVID vaccination, which we now have readily and freely available, doesn't reach everybody. And we see more and more patients with COVID.
So why the need for the vaccine now? I mean, now that we think our life is normal, do we still need to be vaccinated? You think so?
Absolutely. What we are seeing now, and my colleagues can also say more about that, is that the people who get most sick are the people who don't have the vaccination. And those are the people that end up in the hospital.
Okay. So the difference between those who are vaccinated and those who are not vaccinated, the number of the rate of the increase in the infection is more on those who are not vaccinated.
Exactly. And what is also most importantly to remember is that they get sicker.
Okay.
So it's not that you don't get COVID if you are vaccinated, but you don't get as sick and you don't have to be hospitalized or go to intensive care. And also what's important is that if you are vaccinated, the chance of spreading to your loved ones is a lot smaller.
Okay. Okay. So when you have the vaccine, the chances of giving it to somebody else is very low.
The chances of getting COVID, the chances of getting very sick and going to the hospital, but also the chances of spreading it to your loved ones are all lower. So everybody is more protected if people are vaccinated.
Okay, so there's a lot of advantage on this.
A lot of advantage, and especially for something that is free.
And it's free.
It's free of charge.
Because people are so worried, and there are a lot of various stories. I mean, for example, vaccination can cause fertility. It was developed too quickly. I really think that the vaccine causes infertility.
I do really understand the concerns there are, and it was developed or brought on the market, I must say, earlier than we know of other vaccinations. But this technique is not new. This technique that made the vaccination has been there for years, only because this was such a global pandemic. All the professors, all the scientists dropped everything they were doing and only focused on making this vaccine. And then, of course, it goes much faster, but the technique is not new. So I think this is a story that has been repeated. It's new, it's come too fast, which is not completely the truth. It has been there actually for a while, only for this COVID-19, it was the last bit was developed faster than we are used to, because everybody stopped what they were doing and only concentrated on making this.
Yeah.
Oh, I just want to say that there are some side effects to the vaccine, but infertility is not one of them. Yeah, definitely not one of them. And there's a lot of concern in young women that I see in my clinics about, I'm going to take this vaccine, I'm not at a really high risk of getting sick, but is it going to give me problems with having babies or with my womb or anything like that? I want to say, no, it will not.
It will not.
It will not. I can tell you a lot of other things it can do, especially in the first 24 hours after you get the vaccine, but infertility problems is not an issue.
And in fact, the opposite is true.
Exactly.
We are getting more and more research that pregnant women have more problems if they don't take the vaccine and get COVID. There's more and more research. So especially in that group, the advice is do take it, because the side effects of not taking it are bigger than the side effects of taking the vaccine.
COVID is a really big risk in pregnancy, and we see that women, even at the end of their pregnancy, could lose their children if they get COVID at the time of being pregnant. And vaccination protects you from getting COVID. So any of the potential side effects from vaccination will never outweigh the risk to your baby.
But basically, COVID-19 is more dangerous than the vaccine.
That's right.
That's it.
Yes.
Absolutely, yeah. And I think what I would add, I mean, you make a very interesting point about the whole discussion that is being developed very, very quickly, and many people are really getting, frustrated about it. But I think actually, if you look at our world today, I always use as an example, I was born in Ghana, I went to Edinburgh to study. At that time, if I want to call my mom, right, I mean, those days, makes me look old. But in those days, you have to figure it out and find a phone book somewhere else, right? You go there, you wake up from your home, you really go around, you walk, go into the phone booths. And in the UK, they do have these phone booths, red one and others. You go there, you pick it up, and then you call home. You call, because my mom hasn't got a phone at the home at the time. So I have to try and find someone else to go there and get my mom to come on the phone. So I call, And then I just hang around, someone to go and fetch my mom. And then when my man comes in and I talk, and then when I talk, I have to stop very, very fast because the money keep on going. Right? Today, you know, when I call my mom, as soon as I call, she just pick up her phone and then answer. So the technology and things have changed so much. So if you can now sit at home and call your mom, you know, without having to go, especially during the winter, having to go in the cold and get a phone booth and call your mom, but now mom can pick it up. That's exactly what is also happening in the vaccine world. Things have changed, the technology has changed. You know, you do things much more faster. You know, things are not going to sort of taking years to do, you can take just 1 month to do. So the process has been done very, very well. So don't get, you know, worried about it, because what they've done is they've really, really taken time to scrutinize everything. And it's safe for everyone. So please don't get yourself being deceived, because, you know, if you deceive yourself, then you won't use your new phone. You still go there and use your phone.
It's a very, very good example that you're giving with how technology is working these days. Because, why do we think that things are improving? But if it was taking years to come out with vaccine, and now we are in a world that things are moving so fast, and vaccine has been able to come out so quickly, because this pandemic was killing people. So why this doubt? So, Prof, I think this is a very, very good example. You know, lots of people in the community have been vaccinated, and some are not. But we all hang around and do things, you know. So those who are vaccinated, they think, did we decide too quickly to do this? Because those who are not vaccinated, we don't see much people getting sick in the community. We are seeing the numbers, but we are not seeing people getting sick. So why should we go in to get the vaccine?
It's because they're not on my wards. It's because it's really hard to see what's happening inside the hospital when you're outside in the community. So the vaccines are protecting people from coming into the hospital. And we're seeing primarily the people who haven't been vaccinated or who have weakened immune systems and have tried to get vaccinated, but because of an underlying illness are still getting sick. And I can tell you it's a hell on the wards. So I just wish sometimes that we could, you know, make movies of what it's like to be surrounded by so many patients so that people can see what it is to lie in a bed and have COVID, because it's miserable and it's scary. And when you have 4 or 5 people in a room and you're lying in that bed and you see someone across from you having to go to the intensive care, and when you are trying to make it to the bathroom but you can't make it because you're so short of breath that you can't even sit up straight in bed. I wish that people would see that about this disease. It's terrifying. And the scans that we see where people's lungs that are supposed to be black on a scan are completely white because what the virus has done. I think there's such a big disconnect between what people are experiencing in the community and the devastation of the disease that we're seeing inside the hospital walls.
I think also where people are not opening up, you know, because even with this broadcast, we wanted even people who had the vaccine in the community to come and sit down with us, but it was even very difficult. So you may think your neighbor is okay, the person is sick, but the person will never tell you he had COVID, and we think, oh, nobody's getting sick, and we are hanging around. Yes. And then
yes,
and it's quite sad, because I think that, you know, what I find is very, very frustrating as you know, those people that think they've got a COVID and they don't want anyone to know. Why? I mean, you know that the world, I mean, the most powerful people on earth, you've got it, people come out. You know, it's very common thing. So why do you sort of go so much length to try to hide it from other people. It really doesn't. I mean, even if you count it, you know, Prime Minister in the UK had it, you know, Trump's had it, you know, Canadian Prime Minister's wife had it. So many people have had it. So why do you think that, you know, you don't want other people to know?
Okay, the person is vaccinated and he had the virus. Can he give it to somebody who is also already vaccinated?
Yes,
It's possible.
it's possible, but it's less likely. So if you have two people who are vaccinated,
Yeah.
the chance that the vaccinated person will give it to the other vaccinated person is much, much lower
Lower.
than the chance that an unvaccinated person will give it to an unvaccinated person. And on top of that, there's a much, much lower chance that they'll get sick. So what we're seeing in vaccinated people is that when they get the virus, they either don't have any symptoms or they have very mild symptoms, and they're sick for a very short amount of time. But the vaccines were not made to prevent mild and asymptomatic illness. They were really made to prevent people from reaching the hospital. And that works above 90% of the time if you're vaccinated.
Okay. With all the vaccine around, people are getting vaccinated and still the rate of infection is so high.
Yeah.
Why?
Yeah. Because there are a lot of pockets of communities where the rate of vaccination is quite low. And there are still enough unvaccinated people that they're at risk for getting severe disease. So we're primarily seeing that the virus is spreading in places that don't have high levels of vaccination.
Because we are hearing how high this infection is. So, I mean, we are thinking, is this vaccine really trustworthy?
Yes, definitely is. Because the infection rates that we're seeing now, with numbers above 20,000 per day in the Netherlands, that's 3 to 4 times higher than we had in the other wave. So the amount of virus that's circulating now would have devastated us in the last waves. But we're seeing that vaccination is protecting us. Despite the circulation of the virus being so high, we're still seeing, you know, relatively equal numbers of hospitalizations. So this is the amount of virus, and this is the amount of hospitalizations, where before this was the amount of virus and this was the amount of hospitalizations. So the vaccines are helping us as a country and as in our communities.
Okay.
That makes sense.
No, it makes absolutely sense. I mean, Dr. Harris is saying it very well. The vaccine is stopping people from going to the hospital and stopping people from dying. So that is exactly what it was made to do, and that is what it's doing. If we would have had those same numbers as we're having now before people were vaccinated, I'm afraid to even think what would happen, because we wouldn't be able. If you had a car accident, you wouldn't even be able to go to the hospital because it would be already full with people with COVID, people dying in the hospitals from COVID. Then, you know, it would have been very, very catastrophic. Yeah. So that is important to know. The vaccine doesn't stop COVID completely, but it stops you and your family from going to the hospital and dying.
An example, I had a family. There's a husband, a wife, and a son from this community, from Zuidoost. The husband was vaccinated, and the wife and the son were not. The wife and the son lay together in my ward for 2 weeks, and the husband didn't reach the hospital.
Yeah.
So this is a common thing that I'm seeing. But the husband did have COVID, but he just was protected from having bad COVID.
What is the use? Because if you are home, and because I know my age and I don't want to take any risk, I get vaccinated, and maybe your child don't want to. Yeah. In fact, it's so sad so that we can't get through to them. You know, and some will be saying, let's wait and see what will happen to those who are vaccinated. If they are still alive, after some years, then we will decide also to do it. We've had people have been vaccinated, and now we are hearing we have to go again for what? A booster.
Yes.
How often are we going to be vaccinated?
Well, I think that is a very, very good question. Let me give another example of a different vaccine that we have to repeat, which is the flu vaccine.
Yeah.
We do that every year. We've been doing that for how many years already? Because we know that after a while, the strength of the vaccination, it comes down. And now we've seen that also with this COVID vaccine. So after a period of time, the vaccination strength gets weaker. So you have to repeat it. And how often we'll have to do it, time will tell. But we know now, and I'm so very happy that we even have these vaccines. Because remember, 2 years ago, we had nothing. We said, wash your hands, sneeze in your elbow, don't go close to people. And these things are still very important because not everybody has been vaccinated. So those things are still important to do, but the vaccination, as we know now, has to be repeated to keep you strong.
And you know how often?
We still have to see how the body responds to that in the future. We're not
yet.
absolutely sure yet.
Yeah.
But I think you're right. I think, remember that this is a new condition. There's still a lot that we need to learn about the coronavirus. But what we know now is the booster is actually very good for you. Was it yesterday also was a very big study published in Lancet, one of the biggest medical journals. And they did a work in the UK showing the different vaccines and how they actually increase the immunity. And it turns out that those boosters have a huge importance because they actually increase your immunity very, very importantly. And that means that once you're boosted, it also means that you're more protected. So it's very, very important that now inviting people to come for the booster, those that have been invited, it's very important that you go for it. Actually, I had mine on Thursday. And I'm sitting here perfectly okay, right? Great example. So it's very, very important that when you get information from your GP or from your doctor coming for the booster or from KKD or whatever, you need to go it because you know that it can protect you. And I think that this is the new knowledge that we know. Whatever is being done, I think I need to emphasize this. Whatever decisions that are coming to the people, it's not just coming out from somewhere else. It's based on science, and the scientific knowledge is actually what is basically driving everything at the moment. So now we know that the scientific evidence shows that the booster is good for us. And that's why it's so important that, when you hear from the GP, from the doctor, or from anyone, you need to go for that because it's certainly a very important part.
Okay. Now with the rate of infection, people are now trying to consider to get the vaccine. Okay. Those who don't have it at all are now going to do it. Now there's a booster. Are they going to have 3 vaccine at the same time, or how is it going to be?
Yeah, that's a very good question. It's never too late to start with vaccination. So whether it's your first or your second or the third, which we are now calling the booster, you can go to the GGD. In fact, you can make an appointment or even go without an appointment. And depending on whether or not you've been vaccinated or the first or the second time, you get which one is for you. So you always start where you are.
Okay. And the booster, are you going to get the same vaccine what you had previously, or they are going to it's a different vaccine altogether?
Well, the GGD or your doctor looks at your situation. So you don't get them at once, that was actually your question. You really follow the protocol as it was made by science, as the professor said. For people who've been vaccinated like the first and the second time, the booster now, the third one, you get after a period, at least 6 months after your second vaccination. And that is either one of 2 vaccines. And we know now that You can even mix them if necessary. So it doesn't have to be one of the first two that you had. It could also be a different one or the same one. But it really makes your immune system, so the ability of your body to fight against disease, makes it stronger.
I had a good friend who he's a heart doctor and he treats athletes. And a lot of these athletes, like football players and things like that, are scared to get the vaccine. And he said, Vanessa, can I tell them that the vaccine is like a workout for their immune system? And I was like, oh, I think that's great. And you don't get strong with just an hour of working out. It's like they're not that beautiful, all those football players. They just did an hour of a workout. No, you need to first do one vaccine. You work out your immune system a little bit at a time. You let it does the work for you. It takes time for your immune system to mature, to get strong. Then you do it again to make it even stronger. And then you help it a little bit with a booster. So it takes work and time.
That's a very good one. I'll tell that to my patients. And in fact, it's not something new as well. We know this from other vaccinations as well. For example, the hepatitis B vaccination is also something that you do one time, you do it again, and then for your body also to recognize and do the workout. I like that one.
Mm-hmm.
Yeah.
And we know that different vaccines last for different amounts of time, and we're just too early to know, is this going to be okay for the rest of our lives, or is this something that we're going to have to come back to? So are we strong enough now, or do we need more? And that's a question not only of how strong is our immune system, but how much is the virus going to change? And we're seeing that with these new variants. So it's just an open question. But having the basic strength to be able to fight it now is super important.
Yeah. And is it necessary for the younger people to get vaccinated, and why? Because there's a common idea that they have a well-functioning immune system,
right,
and that they won't get sick.
Yeah, the chance that a young person will get sick is many, many times smaller than the chance that an older person will get sick. But that doesn't mean that you can't get sick, that you can't get severely sick. And it also, I think vaccination is not just about yourself. It's about protecting the people who can get sick, even though they've been vaccinated. The elderly people around you have not been vaccinated. So I do think that a lot of vaccination is taking care of the community, and taking care of yourself in the future. Yeah. So I see it as both things, that you protect yourself, but you especially protect those around you.
Yeah, well, you may be stronger than your mom who has some health issues, so you have to also think about the family and try to protect yourself and protect your loved ones. Dr. Harris, in fact, this has been really good, and what I'm really happy with, why the youth are not doing it about this infertility thing. And now you even mentioned that even pregnant women, it's important for them to also get the vaccine to protect themselves and their babies.
Yeah.
The fear was they are afraid that the vaccine may damage the baby. But you've made it clear today that that's not the issue, right?
That's right, that's correct. Yeah. When you're pregnant, you're taking care of yourself and another child, and if you get sick during pregnancy with a virus like COVID, we know it as well for influenza, it really poses a risk to you as a mother, but also to the health of your unborn baby. So we even recommend that pregnant women especially get vaccinated.
This is a personal question. The house doctor, how supportive is the House Act behind this vaccine? Because I want to put myself an example. I have a child with disability, and when I have to go and get a vaccine for him, the Logier House was telling me that I needed a permission from the House Act. Through stemming, the House Act have to say that it's okay. And the doctor told me that he can't give me that, he can't give that to stemming for my child to have the vaccine, the decision should come from me. If the house doctors are not so confident to say, okay, he can have it, how do you expect the lay person out there?
Yes. Yeah. Well,
What is my personal experience?
Well, I think that's a very good question, and I have a lot of patients who come to me and say, "Doctor, what do you think? Should I have it or not?"
Yeah.
And what I do as a doctor is I give my medical opinion. I can tell you, are there going to be side effects, or what is it going to do for your health and for your immune system? But I cannot force people, of course, to have the vaccination. Scientifically and medically speaking, we are absolutely for people getting the vaccination. But we don't force it on people. We can advise. So we can't say you have to, but we can advise you should have it if you want to protect yourself and your loved ones. But it's always a decision that you have to make for yourself. So I think there's a difference between my medical opinion and for yourself to decide whether or not to vaccinate. But do it on the basis of the proper information, because there's a lot of disinformation going around about, like we were talking about, the fertility or side effects, or it becoming that it was developed so quickly. If you make your decision, make it on the proper information and talk to your loved ones and also to people who know what they're talking about, and not information from internet which is just made up. So I think that is the role of doctors and other experts also, to give you the proper information so you can decide for yourself. What we know now is that vaccination stops people from getting very sick or having to go to hospital or die. That is the scientific proof.
And I think it's also, I think this is a great point, but I think it's also very, very important to know that, the doctors up there, in the end they will give you the decision, but it's out of the respect, is the families that actually need to consent to that. The doctor cannot just say that, here I am, take it or lump it. The doctors cannot. So the doctors give you the most available information up there. But you as the person, you as the family, has the, the overall decision-making power to basically say, yes, I would do it. So the doctor cannot just, agree for you. You need to agree for that. And that's how the system actually works.
And actually, maybe in your specific situation, the Logier House also wants to know, are there any problems that can be foreseen that this person should or should not get it? And actually, there are very, 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 very few indications that somebody shouldn't get the vaccine. I think we can safely say for 99.5% of the population in the world, it is safe to get the vaccine. And if not, you can also talk to your doctor if you have any concerns to see what can be done if you are worried but still want to have the vaccine.
That is great. Yeah.
I'd like to emphasize as well that a lot of people with medical conditions that are taking other medications, they're extra concerned about taking the vaccine because they're worried more about the side effects. But it's especially those people that have the most to gain by taking the vaccine. So a lot of other medical conditions are not a contraindication to taking the vaccine. Yeah, and I would say that what I hear are so many people have questions, but they don't take the opportunity to ask their healthcare provider about the answers. And they're looking for answers on the internet with sources that are often scientifically and medically not correct. So challenge your doctors with questions so that we have the chance to discuss them openly. These things about side effects, is it going to change my DNA? Is it going to give me side effects in 2 or 3 years? I can give good answers to those questions. The technology that's in the mRNA vaccines. You give a small piece of messenger RNA, it's called, to an individual, and that comes into the cell, but it never touches or does anything with your own DNA or RNA. It's unable to because your cells can't change it into anything else. It just hangs out there for 3 or 4 days and then it disappears. And what you're left with is your body's immune response to it, which is the same as if you would have had a COVID infection, except that you don't have the horrible risks that come along with COVID. So, these are technologies that have been worked on for 20, 30 years and have been developed to allow us to tackle new difficult diseases. And it's a blessing that we're able to use them and that they are so protective. In the beginning, we weren't sure if these vaccines would work as well as they do, and they work phenomenally well. Yeah.
I'm very happy with this explanation because you work in the community and we have so much faith in our house doctors. Yes. So sometimes I think the house doctor is telling me, oh, it's okay. Then I'm so confident.
Yes.
But if you say I can't make that decision, it's like, hey.
In fact, no, I understand. But in fact, your house doctor is protecting him or herself. They are also taking this vaccine. So you can follow the example. Yes.
Yeah, thank you. This has been very, very, very interesting. What's your take-home message for the community?
I think my take-home message for the community is protect yourself and protect each other. And you can do that by taking the vaccine and keep on testing if you do have complaints.
Prof?
Yeah, I would say that, I can agree with you more, but I would say that it is absolutely important that if you have not vaccinated, please just go up there and get vaccinated. Because as you just said, that you are not only protecting yourself, but you're also protecting your loved ones. Your brother, your sister, your children, your grandparents, So it's absolutely crucial. And it becomes even more important because you also know that now the corona seems to be changing, putting a different hats on, right? Mm-hmm. Now you hear that all of a sudden he puts this called Omicron hats on.
Good.
So
you mentioned it.
Exactly.
What is that?
Yeah.
Some highlights on that before we run out. Should we be worried?
Well, I think that at the moment, as I said, that all of us here, we basically talk from scientific knowledge. We are not coming here and say it from our own head. No, we base on what is the evidence is out there. Now we know that the Omicron appears to be actually quite worrying. We know that in South Africa now, Dr. Harris was actually just saying to me that actually the rate of hospital admissions is actually increasing very, very fast in South Africa because of the Omicron. And that becomes actually very, very important now, ever, that people get protected. That means that we need to get the vaccine. You don't want, to all of a sudden Omicron comes in with a different hat and then you get caught up because you have not been vaccinated. The evidence seems to suggest, it's not concrete, the little evidence that come in seems to suggest that it might be, especially the booster, might be more protective against the Omicron. And the difference is probably Dr. Harris, who is working on this topic, will explain it more. But if you see the coronavirus, it comes in and then you see all these pictures and then you have some kind of, if you like, some nails sitting on them, right? Exactly, some sitting on them. But it appears that, the previous ones, it has got about, the Delta, it has about 11 or 12 nails sitting on them. This guy comes in with about 30 of them sitting on them, right? So the Omicron comes in with a lot of nails sitting in the
It's more dangerous than the COVID.
That is the fear, because the previous one comes in with a little bit hard, with a little bit nail sitting on them, and this time you have the one with about 30 nails on them, so you really don't know how it's going to work. But there's a lot of scientific work currently ongoing, and then hopefully within the next couple of weeks, you're going to hear a little more about it. But certainly, from what we hear, the infection rate through the Omicron appears to be pretty high. Probably we'll say a little more about it because the
virus is getting smarter,
Yeah,
so we also have to be smarter.
Smarter.
So we have that opportunity.
Yeah.
So let's take it.
That's right. Yeah.
Wow.
It's coming with nails, yeah? The nails that you see on it. Now it's all of a sudden you dress very, very nicely.
Yeah.
It is scary.
Yeah, it is.
So it means we really have to run and wait for this booster before it attacks us.
Yeah. Well, I completely agree. I think on the one hand, you have a virus that is evolving, and it's faster than we are. And if we don't do the basic things that we have in our hands right now, then it'll be faster than us, because it replicates much faster than we do. So, get vaccinated if you haven't gotten vaccinated yet. Talk to your house doctor so that you don't end up on my ward. Stay outside of the hospital.
Yeah.
Test yourself if you have symptoms, so that even if you're vaccinated and you have symptoms, test yourself so that you don't spread the virus to people who are vulnerable around you. And if you have an opportunity to get a booster, do it, so that we have more immunity together to help us combat this disease, because these are really hard times. They're hard times for people who, can't see their friends, who are working in the healthcare sector, everyone is having a hard time. And any small thing that we can do to relieve, the burden of illness that this virus is giving us, we should hold on to and fight hard to use. Yeah.
The home test.
Yes.
How effective is that?
If you have COVID,
Yeah.
the chance that a home test will say that you have COVID compared to a PCR is a little bit less. But if you really have COVID, the home test will tell you that you have it. And it won't be false positive. So if it says that you have it and you think, oh, I don't have it, you probably have it. So listen to your home test. But if you have a lot of symptoms and your home test says that you don't have COVID, check again with the GGD. But use the home test, because it's a cheap, easy way to test yourself in 15 minutes. And if you're going to a group of people and you're worried that some people might not be vaccinated, or there will be older people there, it's a really good way to protect those around you.
If the home test says you are positive,
Then you're positive.
then you are positive.
Yeah.
That you don't need to go to the KKD to test.
Well, what we say
anymore.
now is if you're positive, you go to the KGD and confirm.
And confirm, okay.
And if you have symptoms, what you have to do is at least test, either by home test or by the GGD test, so that you don't walk around and get other people sick as well.
Yeah.
So whatever you do, get tested, either by home test or the GGD test. That's most important.
That's a clear, good message.
Yeah, that's
Yeah.
very good. So to be clear, when you have symptoms and the home test says you are negative, it's still better to go KKD and get tested and be sure.
It's always good to be sure.
Yeah.
And now we know that the home tests,
Yeah.
first we weren't so sure if they were very good or good enough. We know now that the home tests are pretty good. So at least do that. But the GGD test is always better.
Yeah.
So if you can, go to the GGD, but be safe and do at least a home test.
Well, viewers, I think you've heard a lot. You've been well informed, and I hope most of our concerns, listening to the professionals, this will help us to make the right decisions for ourselves and also for our loved ones. See you next time. Bye for now.